Okay, good morning, all.
Good morning. So when you're ready, you will have 3 minutes, which you will see the 3 minutes on the top right corner. And then after that, we have a Q&A, 5 minutes Q&A. So when you're ready, then your 3 minutes will begin. Just signal us when you're ready so that we know when to run the timer.
Okay, so I will be sharing my screen now.
Okay. And there's an echo from your side. If you can mute one of the devices there, please. Sorry, Augusta, can you pause the video quickly? Can you pause the video? Because it looks like your method was to present an audio recording of your pitch. So, and we're struggling with the audio. I see it's about to finish, but if you can just, I think just in 30 seconds, maybe give us a brief about the idea, it will be better.
Okay, so do you want me to repeat what we said in this, on this clip?
No, just in 30 seconds, give us a summary of the idea, because we struggle with the...
So the whole essence of Africa Medical Marketplace is to create a B2B platform where global medical manufacturers, suppliers, and distributors across 54 countries in Africa can display their medical products and sell across Africa. The whole essence of it is to create about quality and affordable healthcare in Africa. We also have what we call the net medical platform. The essence of this is this: there are hospitals that are at advanced level, especially at the developed nations, developed states, who are permitted to use hospital equipment at a stipulated time, maybe 1 year, lifetime, and others. Now, with the help of them discarding it, instead of them trashing it, where hospitals and remote areas need access to quality healthcare and affordable one, they can just discard it. They can just indicate on our platform, and people that need it in the remote area can pick up what they have. and just fix it. With that, people at the grassroots level, they don't have to pay through their noses. They don't have to, as much as we believe in God, we know that in Nigeria, let's say in Africa, most people decide to pray to God and turn up to God because they don't have the fund needed for quality healthcare. So the whole essence of this is to make sure that people at the grassroots level don't have to keep dying because they don't have the luxury of traveling out of the country to have a quality and affordable healthcare. Thank you, sir.
Okay, thank you. So in summary, it's like a platform that it's like a medical platform basically that provides healthcare to people that can't afford it or that can't access it.
Okay, so the three components of that platform. The first one is a trading platform where people sell medical equipment. With that, hospitals don't have to break their necks by going to middle people. They just look at it and buy according to their budgets. That's the first one. Then the second one is biomedical near us. Hospitals that don't have, most hospitals won't have access, won't have the data of all the biomedical engineers. So they just easily go to the biomedical near us section and pick the details of the person they need within their country. The third one is the donate medical platform where hospitals at advanced level can easily discard their products or the health equipment they have, which they are not using again, to make sure that it gets to the hands of the people at the remote area. Hospitals in the villages that do not, or in the growing aspect of Africa that do not have capacity to procure new ones. Thank you, sir.
Okay, thank you, Mr. Kule.
Hello?
Hello, sir. Good morning, sir.
Yeah, good morning. So I was just, I think the question I have, what's not clear to me is how the platform will generate revenue.
Okay, so we have the subscription model and we have the commission model as well, where sellers can either subscribe. Yes, we are working with the subscription as sellers subscribe according to the packages that work for them because each package comes with their unique value proposition for their business, for their sales. So that works. We are also working on the commission model where every transaction generates revenue for African medical marketplace. Thank you, sir.
Okay, but maybe I will let my other colleagues ask questions because I'm just wondering that. So in this case now, if you take an hospital like let's say Lagoon Hospital,
Yes.
Lagoon will be registering on the platform and paying a subscription.
Okay, so no, we don't deal with hospitals. We deal with medical sellers. They are the ones that pay for it. So let's take, for instance, that you got a contract. Okay, let's use Nigeria anyways. Let's take, for instance, that you need a CRM machine in Nigeria, and someone is telling you that the price is 35 million naira. And your hospital cannot, Lagoon Hospital cannot afford to pay for that because it's out of their budget. Now, going through our platform, you can see people that sell for 15 million, you can see people that sell for maybe 12 million. You now look at the features and ask yourself if that is what you can afford. Of course, there are hospitals that can afford the one of 100 million as well, as long as they get quality. So the real essence is for people to buy according to their budget and buy exactly what they want. Now, when it comes to the Donate Medical platform, people like Lagoon Hospital,
So
if they don't have...
I understand, because we have limited time. I'm just trying to probe the business model properly. You know,
Okay.
hospital equipment, when Lagoon wants to buy, you can buy from Siemens, you can buy from GE, you can buy from, so you buy from these manufacturers and those manufacturers maintain and service those hospitals. And
Yes.
what you tend to have at times for those manufacturers, you don't even need to pay cash. They do leases as well. Mostly that's where they are transitioning to today.
Yes, sir.
So,
yes, sir. The rent for people that want it to.
No, I'm coming. So the question is, who is going to list on this platform? Is it GE, the owner and seller of the equipment? Is it Lagoon, the hospital that has bought? Or another hospital that wants to, because the person that will sell a GE equipment at a price lower than GE, is it because it's used? It's just to clarify how that, and you know, for you to generate money on a recurring basis, who are these people that consistently have hospital equipment to sell that will be listing there and paying all the subscription that you require?
Okay, so our target audience are the manufacturers, the traders, the people that have hospital equipment, the people that sell them across Africa and globally, the direct manufacturers. However, companies like Lagoon, if they are looking for another means of generating revenue and they feel like they have this machine and instead of leaving it and not servicing it constantly, that they can lease it out, they can indicate and be sellers on the platform and lease out the equipment for a stipulated time and then take it back. Is an interactive platform that you have every right to interact with the person that is intending to pick your equipment and get clarification. It's up to you to know whether you want to lease it out or not. However, we do our own part by checkmating that both the sellers and the people that are coming from to our platform are the real deal.
Okay.
When I say real deal, authenticity, yes.
Okay, thank you. I think we're out of time now. We'll have to move to the next contestant. Thank you, Augusta.
Yeah, so I think Africa Medical Marketplace. That's also one that I think is anything healthcare in Nigeria. It's especially even Africa. It's something that requires a lot of help, and the segment they are focusing on is one where we are also struggling because equipment availability and maintenance is a big headache for most hospitals. And I like the focus on the platform where they are trying to connect the areas of deficit with the areas where there's potential for surplus or even upgrade of equipment, which may still be very useful to other hospitals in different places. And that same platform can be scaled further to even be used to trade multiple things within the healthcare value chain. So the potential is significant. So I feel maybe the only other comment will be to say, okay, you just do some more work to really define who the customers will be. And that can be supported by adequate research and surveys to be sure that at least those businesses or manufacturers that will be placing their equipment on the platform, they've really engaged them on to ensure that at least the appetite is there and the willingness is there, such that and there can be long-term, the partnership is also there. So, and that requires them to also do some work on the other side to be able to aggregate who the potential buyers will be. And because without the buyers, you will not be able to justify to those that will place the equipment on the platform that there's business there. But I think it's a very, very good business model that will also help contribute significantly to solving the challenges in the healthcare system.
Awesome. Yeah, 100% agree with Kunle. Just to add that for the healthcare marketplace, I think an innovative approach could be maybe embedded finance within a marketplace, or, in terms of when I think about what are the value that a healthcare equipment seller would be looking for is how do I sell? How do I sell to more people, right? And so maybe they might not be as excited about just coming to a marketplace to list their products, but maybe if there's an option that you're giving them a way to drive sale by offering some kind of, pay small, which is now common, right? So if you embed finance within that platform, so I don't think we saw anything apart from you just being a marketplace. That's why we are a bit like this, this value proposition is not strong enough for most of these like Philips and the rest of them if they were to come to your platform. But if you are telling us that, hey, yes, this is a platform where we're listing products, but there's going to be embedded finance, which will make it easy for the hospitals to pay gradually. like to pay in installments. And this is kind of the innovation I'm seeing now, mostly with a lot of products that are launching in Nigeria, is that you're seeing this element of like trade lender, for example. They make it easy for for sellers to be able to then get some kind of financing that helps them and for the buyers to be able to pay upfront or pay later. So there could be some creativity around thinking about what is your major differentiator as a marketplace. I think it's not enough to just be a marketplace. So something to think about. Sorry guys, my light went off. It's a Lagos thing, I guess. So yeah, but I hope that helps. But I think, yeah, it's never easy to start a company. So kudos to you for what you've built so far and the thinking around it. My immediate feedback is just think more around your differentiation, because there are platforms like this already. I can count, a couple that exist, but they might not be serving the market as you're thinking. So yeah, that would be my, just again echoing what Kunle said. You have to think more around them, do the market research, understand what what the market needs, and try to build for that. Yeah.
Yeah. My comment for Africa Marketplace would be, I like the idea. I would just say the way you presented the idea wasn't quite as compelling, if I can say that. And I'm saying this not just for the sake of this platform, but also for other platforms that you may want to go and pitch the idea. Your choice of sharing a screen with your recorded pitch didn't work to your advantage. And also the idea, we would have easily captivated my attention if you had said this is the Jumia or the AliExpress of healthcare equipment, for instance. This would have just totally made sense instantly. And I think that's what you're trying to do. However, I would say there's definitely a market for it, because right now I don't know where, if I'm setting up a hospital, where do I go and source for equipment? Or even if I'm not setting up a hospital from scratch, an MRI machine gets spoiled, how do I find the easiest source and quickest, most reliable provider or supplier of that? Your platform could have solved the problem for me. But of course, with this type of platforms, it will be a case of not just trust of suppliers, but also issue of logistics. Because some of those equipments are moving and delivering them, even though it may not be your own job to do, it's something that is very tricky and could affect the platform itself that you are building. But I would say, I think it's an idea that makes sense, but a lot of work has to go into getting the suppliers versus the people in demand of it, and also making sure that the logistics side of delivery of equipment or goods of medical services are done effective. So that's what I would say for Africa Medical Marketplace.